Here we sinus. First sinus we see in sigmoid sinus, and second sinus we see superior petrosal sinus and inferior petrosal sinus. And next sign we see occipital sinus. Then we see transverse sinus. Then we see cavernous sinus and intercavernous sinus. They make a circle here. Then we see sphenoparietal sinus. Sphenoparietal sinus. Then we see superior sagittal sinus and inferior sagittal sinus. They are connected by straight sinus or sinus rectus. Then we see here convexus sinus. Convexus sinus connected transverse sinus, occipital sinus, and superior sagittal sinus. Here see basilar sinus and marginal sinus. These are the sinus in study in CVS.
Inside your skull, you have special air-filled spaces called sinuses. These air pockets are connected to your nasal cavity, the area behind your nose. Think of them like small caves within the bones of your face. Sinuses are lined with a moist membrane called mucosa. This mucosa helps to keep the sinuses healthy. Sinuses are not just empty spaces. They have important jobs to do. Primarily, sinuses make the skull lighter, which helps with balance and head movement. The air passing through sinuses is also warmed and moistened before reaching the lungs. This process helps us breathe easier. Additionally, sinuses give our voice its unique resonance. They act like echo chambers, amplifying and enriching the sound we produce when we talk or sing. Finally, sinuses provide a cushioning effect, protecting vital organs like the brain and eyes from injury. There are 4 main pairs of sinuses, and they're named after the bones where they are found. First, the frontal sinuses, located above the eyes and the forehead bone. These sinuses are usually fully developed by age 7 or 8. Next, the maxillary sinuses, the largest sinuses, situated in the cheekbones under the eyes. They are present at birth but grow significantly throughout childhood. Then we have the ethmoid sinuses, a group of small air cells within the ethmoid bone, between the eyes and behind the bridge of the nose. These sinuses are also present at birth. Finally, the sphenoid sinuses, found deep within the skull, behind the ethmoid sinuses. The sphenoid sinuses develop later in childhood. To remember the names of the 4 sinuses, think of the mnemonic, "Some elephants found money." Sphenoid, ethmoid, frontal, maxillary. Sometimes the sinuses can become inflamed or infected, leading to a condition called sinusitis. Sinusitis is commonly caused by viruses, bacteria, or allergies. It can cause symptoms like facial pain, nasal congestion, headaches, and fever. In rare cases, sinus infections can spread to surrounding areas, leading to complications like orbital cellulitis, an infection around the eye, or meningitis, inflammation of the membranes surrounding the brain and spinal cord. If you experience severe or persistent sinus symptoms, it's important to consult a doctor for proper diagnosis and treatment.